Good afternoon, everyone. Welcome to the Office of Health Sciences Town Hall. My name is Laura Kuchida, and I'm the Chief of Staff for the Office of Health Sciences. Before we get started, I'd like to share a few housekeeping items. First of all, this is a Zoom webinar setup, so everyone is muted except for our presenters and speakers. The chat function is disabled at this time, but you can enter questions into the Q&A feature through the little button at the bottom of the screen. Again, welcome, and we really appreciate you took the time to join us today. So without further ado, please welcome the EVP of Health Sciences, Dr. Norman Beauchamp.
Thank you, Laura, so much. I really appreciate that introduction. Thank you, everybody, for being here today for our town hall. One of the important things that we really called out at the start was that our commitment in health sciences across the colleges and the practice plan is really hope, health, and healing for all. And now more than ever, the role of health sciences and the university in bringing hope, health, and healing is absolutely critical. And one of our goals in the town hall is to share the work that's happening in health sciences and the university and within the colleges. And so we've constructed the agenda where I'll first provide university updates. Then I'll talk about some of the work that we're doing in the health sciences. And then we'll hear from college leaders and MSU Healthcare on what's happening in the colleges and in the practice. We'll talk about a new initiative called Continuing Conversations, and then we'll open it up to questions and answers. One of the things that we would like to do is give our very busy students back the gift of time. As a part of our outreach, we included connecting to this town hall, which is really designed for faculty and staff. And we will be having additional outreaches from the colleges and as a part of our continuing conversations to students. So if you're a student and you're logged in, please feel free to go back to all of your other very busy activities and don't feel obligated to be a part, to attend the town hall. So we changed the order of this talk on Friday, and we changed that because there's really two significant announcements that went out. First was that MSU is going to require all faculty, staff, and students to be vaccinated, and that face coverings must be worn indoors on MSU campus facilities and sites, effective essentially now. In thinking about that, I want to just first communicate that there will be a lot of information coming out regarding how these will be implemented. We felt it was very important to get the message out about vaccinations, to give everyone the time that hasn't been vaccinated to initiate vaccinations. But we also recognize that there are questions. And so in the next couple of days, you will see frequently asked questions that will be sent out to all of you. But we also will have some time today to answer some of the questions that I know folks have. What I'd like to say, what I need to say in regard to making vaccines mandatory is just thank you. The health colleges, the practice plan, health sciences really played a central role in these decisions. There's been so many communications, so many efforts across the colleges to practice that have been values-based, have brought forward the science of prevention. There's been leading by examples where people on their own time have volunteered effort. The health colleges have put in place really a mandate for students that are involved in care. And the effort at enabling all voices, Jennifer Johnson and her leading the Senate, the faculty across the university coming forward and advocating for vaccination requirement, as well as the students. And so I just want to thank all the effort that went into what I believe is such an important step for keeping our campus safe. And that's really the key. And some of the things that went into this that, again, led to many of you advocating is what we're learning. The Delta virus is more transmissible, right? They compare it to influenza, Ebola, smallpox. There's a measure that's used called R0, and it really has shown that the Delta strain is 2 to 3 times more infectious. And the most important things that we really want to do is to prevent deaths and to prevent our hospital systems from becoming overwhelmed. And what the experience has shown us is that, 98, 99% of the deaths that are due to COVID-19 now are in the unvaccinated. And the Delta variant, it makes up about 90% of the COVID-19 infections. And so we think it's really critical that we as a campus require vaccinations. And again, really proud of this commitment. We're following closely the CDC, and they came out last week based on the observations about the Delta variant that vaccinated or unvaccinated, their recommendation was to wear masks in public, indoor settings in areas of high transmission to help prevent the spread. And so that is also why we embraced the requirement to wear masks indoors. Some very encouraging news has come from the survey that we've sent out to students, faculty, and staff. When we look at the number of responders so far, we've had close to 28,000 responders. 16,000 of those are students. About 6,000 are employees. And then there's a mix. And what we're finding is that of the students that responded, high percentages, close to 90% of students have been vaccinated. And even a higher percent of employees have been vaccinated, and their intention to get vaccinated based on report is high. Now, we've only had response by about half of the folks that we've sent this out to, so there's some bias, but this at least is very encouraging that the campus, as we heard in the votes of the Faculty Senate and the students, do see a priority to get vaccinated. Now, there will be some exemptions to getting the vaccination. They will be religious exemptions and medical exemptions. And it's always important to recognize that there are individuals who have a sincerely held belief that preclude them from receiving the COVID-19 vaccine. There'll be more information about, what makes up a religious exemption, but it really would be this concept of a sincerely held religious belief, and that's held. The other is there'll be medical exemptions. Individuals that would request an exemption that precludes them from receiving the vaccine. Again, the list of exemptions is being put together. Some of those include allergies to the vaccination, being severely immunocompromised, may be one of the indications as well. What will be put in place is a mechanism where individuals would get a signed medical exemption from a health practitioner, and that would be submitted and approved. We also have come together in a way that we make getting the vaccines as accessible as possible. Many folks that haven't returned to campus in the health sciences, we've started already in the College of Osteopathic Medicine. CHM is coming back. We've had students in the summer, but we want to make sure that folks know that you can receive a free COVID-19 vaccine through MSU Healthcare Pharmacy if you're outside of East Lansing. This is a website that you can go to find vaccination sites near you. For our international students and scholars who come to us from out of country, what we'll be seeking is, demonstration that they've had a WHO approved vaccination. And certainly we can give them access to, and that should say WHO approved vaccines upon arrival. The other thing that we're putting in place, in addition to the number of slots that are available in MSU Healthcare, is the opportunity to have a high volume vaccination center for a lot of the campus when they return August 30th, September 1st, with a second September 22 and 23. And so this will help largely the large number of undergraduate students that will return to our campus at that time. And it is the case that a lot of this effort is to make sure that, we're prepared. This fall will be the first time on campus for 2 full classes of students. It'll mark the first time for much of the campus, not the health sciences, where the primary method of teaching is in person. And the hope is to get to as close to normal as we can. And we believe that by controlling the spread of the Delta variant, we'll be able to do that. And we, as hopefully you've seen, right, we're vigilant, we're monitoring to see what's happening, and this guides us to other mandates that we would put in place. Again, our core value is keeping the campus safe. In terms of return to work, this is really something that sits within the units, MSU Healthcare, College of Osteomed, Human Med, College of Nursing, working with your supervisors on return to work. There is a link here as well that you can go to that provides frequently asked questions. Importantly, many of you are doing the work that is needed to address what is, fear about the vaccine. And there is still hesitancy that people have. And the very positive thing is that the vaccines have been demonstrated to be very, very safe. But there's some, again, we want to provide resources for you to use as you're trying to encourage individuals about the safety of the vaccine and the value that it plays. And so this is a resource that you can use that has a very nice list of commonly asked questions as well as answers to those questions. It's also been a long journey for so many, right? As you know, the loss of loved ones, the fear of becoming ill, trying to manage work responsibilities, being on the front line, home. And so just to know that there are a large number of resources at the university. Individuals in health care are particularly not good at reaching out for help, really good at giving help, not so good at reaching out for help. And so this is just a link to where you can go to get some of that support. I'll move to another really important topic that I'm just proud of the efforts of the university and the health colleges. There was an initiative about how do we foster a safe campus and really develop a strategic plan to address relationship violence and sexual misconduct. And I want to draw your attention to the output of the RVSM work group. And in it, they talk about respect, prevention, response, really the actions taken to foster a safer campus. And as we think about, taking pride in our organization and that everyone needs to feel safe, the work that's been done is very it's inspirational, and I believe it's incredibly responsive to the survivors, to responders, helpers, the campus community, and leaders. And it just is this bringing together of the values that we hold dear: collaboration, equity, excellence, integrity, and respect. It recognizes intersectionality and the importance of being trauma informed, because so many people have been affected by relationship violence, sexual misconduct, and also a culture of fear in terms of being confident in speaking up. And so what I like very much is, and this was led by Rebecca Campbell, is just a very evidence-based, inclusive approach to making this amongst the safest universities in the country. So I'd recommend that you take a look at that, and I think it's very well done. And I want to emphasize, and that's one of the things that we'll do in these town halls, is there's so much great work that's coming out of the health sciences that I think can help guide the university. It touches on what I spoke to earlier, leading by example. And there was some very nice work that in the College of Human Medicine related to the use of trauma-informed principles and a culture of caring. And I saw that kind of as helping to shape some of the early work. Also really proud of the work of the College of Nursing to double the number of nurses trained in taking care of sexual violence survivors. And it was done in a wonderful way that, again, brought together strengths in the community, identified a need, and then sought external funding as a mechanism to support this. And so really thought that was critical work and something that we should celebrate. This is also something, we had a retreat this morning that we're bringing together the leaders across the health colleges, the practice and health sciences, and really talking about how can we continue to build on creating an environment that is supportive for students, faculty, and staff. And one of the works that was called out that nicely demonstrated how we're better together is the triage response that was put in place. And Tony Avellino did some incredible work and worked with the deans and the practice, OIE. And what we just want to show you is that in the past, part of where there were organizational failings was issues of conflict of interest and not transparency and not getting enough input in making sure that when there was inappropriate behavior, that we didn't put patients at risk, we didn't put students and staff and faculty in harm's way. And the other piece of this too is that how do we make sure that when somebody who has been accused of sexual misconduct In fact, it may be related to a lack of understanding or communication, but not be related to sexual misconduct. How do we also make sure that there's due process? And so what's mapped out here is just the way that within 24 hours, we bring together individuals from across the health colleges, as well as academic HR, Title IX, to do an assessment to make sure, again, that people are encouraged to speak up, that we act swiftly to maintain safety, and that there's process. And this was a nice example of how we came together. One of the things that is also very important is how does, as MSU thinks about its mission, how do we help health sciences contribute to the mission of the university, and the university see the value that we can bring to their efforts as a land grant R1 university. And what will soon be coming forward, we're taking it to the board, is the university strategic plan. And it's been 18 months of effort. It has included input from across the university, and I think it's something that folks are going to be really proud of. And it talks about, by 2030, how can we expand opportunity and bring equity and really renew and restore both our community internally and externally. And these are the domains of effort, and folks from the health colleges have played a key role in developing these. And one area that has come forward that will have the chance to lead is sustainable health. And that's one of the pillars. And the goal in that pillar is to enhance the quality of life for people everywhere by comprehensively leveraging expertise and research activity to improve health and the systems that affect health. And the 5 objectives that have been called out is the first is the internal, right? Meeting the physical and mental health needs of our students, faculty, and staff, particularly in healthcare, where burnout is at 40%. We have more work to do to create an environment that supports, to have a physical plant that supports. If we're going to take care of others, we have to have an environment that is supportive. And this is certainly the case for health sciences, but the entire university. But that is a key part of sustaining health. Partnering with communities and organizations to reduce health disparities. If not us, who? And because we're community-based in nursing, osteopathic medicine, and human medicine, we're really well poised to be leaders in addressing rural-urban gaps in care and to address gaps from a gender, ethnic, and racial standpoint. And we've set a goal by 2030. There's a number of initiatives in which we'll go directly at that. Objective 3, and I think it supported a president who is a clinician, a provost who has a background in health sciences, and really being a land grant university where agricultural health, environmental health, animal health, it all comes together, and also including the arts and sciences in how we can mobilize the entire campus to improve health, leveraging expertise, elevating care, education, and research activities. So this will be a primary focus, and one of the goals will be to get the university to $1 billion in research funding and substantially increase our human health research as well as our clinical engagement. We'd like to lead the nation in devising innovative educational pathways to career and health. And so what this really calls out is that if we look at the individuals that are on this call today, one doesn't have to, and one isn't a nurse or an osteopathic physician or an allopathic physician. required to impact health, right? There's social work, there's PhDs who are finding new ways to advance care. There's MBAs, right? There's all the member of the support staff, communications, HR. The point is healthcare became the #1 employer in the US in 2017. There's so many pathways, and one of the goals for MSU is to develop more pathways to individuals that want to improve health. There's an aphorism I like that goes like this: all people have the ability and deserve the opportunity to improve the health and well-being of others. And so this objective is, how do we connect more to the rest of the university and create those pathways? And then 5 is to work with health and business partners across MSU to ensure patients and families have access to equitable health quality, high quality, affordable, and safer healthcare. So this is directly linked to healthcare and the goals of providing accessible, affordable care. The next steps with the strategic plan, I think this is very relevant, is each of the pillars has an executive sponsor. I have the opportunity to serve as the executive sponsor of Sustainable Health, and we'll work together with the health colleges and across the university to really align the strategic plans at a unit level, college and administrative level, to align with the strategic themes of the university. And importantly, this alignment will also be supported by budget and resource allocation. So this positions us to not only identify the important work that we need to do, but to be able to access the resources needed to do that work. And so what I see as a part of our going forward is really connecting health sciences and the clinical practice and with the rest of the university to map out how we will link to these strategic themes and build that in. Few points on budget. One of the positives is the restoration of salary. We made a shared sacrifice last year, both to a salary reduction as well as a benefits reduction. And the commitment is to restore the salaries. That's been done July 1st. And our hope is, if the budgets trend the way that we expect, that we'll be able to reinstill benefits next July. Also, a key part of the practice is, one, to be a delivery arm for care to people in the highest quality of care, a place to train, an opportunity to translate, but it's also to help sustain the work in the colleges. And our budget this year for fiscal year 22 has an additional $3.5 million that are coming back to the health colleges. There's new leadership at the university, very important. Doug Gage, who many of you know, he served as the assistant vice president for research. He's been the acting vice president for research, and he's been appointed to a 3-year term. He's just done an amazing job, and he is definitely a servant leader, definitely somebody who recognizes the importance of health and health sciences discovery. So I think that is terrific. Marlon Lynch is serving as the 6th chief of the MSU Police Department, and he is one of the most experienced leaders of higher education and policing. And what was wonderful is that his appointment, he was further empowered to be the vice president for public safety, and he's moved very quickly to really go after some of the unjust and inequitable ways that the underrepresented groups were confronted with policing. And it just shows what I see as a very focused effort by the president to create an environment that is supportive and that was responsive. And this came out of a task force to look at diversity, equity, and inclusion. And then lastly, we've appointed our first senior vice president and chief financial officer. This is really important for us at MSU. I think this gives us an opportunity to think more entrepreneurial and really bring together what were, finance and budget sitting separately and have that combined in a way that will support really our efforts to create a financially sustainable and better resourced environment for faculty, students, and staff. Sorry about the train in the background. Hopefully you can still hear me through that. Office of Health Sciences, and I'll speak a little bit louder. I don't know how long our train will keep us company, but really in terms of purpose, we believe that people have the ability and deserve the opportunity to improve their health and well-being, and that all people have the right to hope, health, and healing. Our goal is to strengthen and support each college, clinical practice, and individuals, and by working together, we will transform health and become a national model for quality, safety, and health care. And this is just a new graphic to show that really our goal is to support the efforts of the three colleges, that MSU Healthcare is connected to all three colleges, and really the interplay between care, education, and research is at the core of what we do. And that ultimately our job is to serve and to partner with communities to learn from them and with them. So if our near-term goals is to continue to enhance the representation and the role of the health colleges in the university and foster collaboration. Some of you that have come from other universities, health colleges are not often seen as champions of collaboration, creating opportunities for other parts of the university. I think that's not the case here. The health colleges are seen as highly collaborative. And as we start to grow our scope and scale, it allows us to bring more opportunities and to make sure that those are visible. Similarly, there's decisions that are made at a university level that greatly affect the health colleges. Some of that, for example, is the benefits plan of the university. We're in a position to help provide better and accessible care, but we have to be at the table. And so one of the wonderful things is that we now are at the table. I see part of our role is to, again, share collective efforts across the organization, and I'm joined by 4 of our leaders today to help do that. And then lastly, how do we learn from each other? One of the joys I have is seeing all the pockets of deep pools, I should say, of excellence across the organization. And ultimately, the goal is to learn from each other. And it is this alignment of discovery, teaching, and patient care that is our path to bringing health, hope, and healing. And I show this slide just to really call out that in being successful in our mission, one of the opportunities is to create an environment where clinical excellence happens. We can grow our clinical practice, one, because that's the way to bring best care to the community, but also because it supports efforts in research, education, and community service. And one of the challenges is that historically our clinical practice has not been in a position to support our other activities. And it really is linked, because done correctly, research and teaching then comes back to support clinical efforts. And so we're doing a lot to try to align those missions. One of the things that when I served as dean, we weren't successful in garnering much support back in the spring ask, because it was just hard to to have the case made, I think, for the health sciences colleges and a large university. There's so many priorities. But what I think is positive is the opportunity now to, the importance of the mission to be recognized and supported. And I see that from the president, the provost, and obviously that's one of my areas of focus. And so in the spring ask, we were able to return back to the health colleges, over $800,000 that supported clerkships, diversity, equity, inclusion, faculty recruitment, support staff positions, support for advancement fundraising, space renovations, and research faculty positions. So obviously we want to continue to do more, but hopefully you can see we're starting to try to garner more resources. This is an example of partnerships. I think the partnerships that we have with our health system partners here in East Lansing community and statewide, we're working really hard on that. And the best ways to do that is when the health colleges and MSU Healthcare come together. So one example of support that comes to the health colleges and the practice is a $5 million fund from McLaren, $1 million a year called the Spartan Forward Fund. And we've put in place a mechanism where funding comes back to the health colleges. And our goal is to balance that equally across the three. And you don't see CON listed here, but Dean Rasch is working with his team to develop some of the nurse practitioner clinical practices, and there'll be funding to support that effort. Also building on existing partnerships. We just signed a renewal of what's been a 20-year partnership with Sparrow in the NICU. Amazing MSU faculty running the NICU. I will report that my granddaughter, who showed up 2 months early last year, was a beneficiary of the excellent care there. We're also in discussion. We're not sure if we'll be able to take it all the way through to completion, but in looking at developing a new neurosciences partnership with Sparrow. It builds on decades of partnering around stroke, epilepsy, neurointervention, pediatric neurology, and consulting services. And we're exploring with Sparrow, again, this connection of research, education, clinical care, building on relationships, supporting the mission, and ultimately a healthier community. Two of the main areas that the university budget this year where they're going to invest funding was one, this partnership with Apple, the Apple Developer Academy. This is a wonderful initiative. We're first in the US as a university, and this is to create careers for individuals as developers without requiring necessarily a 4-year degree. So it goes directly at social determinants and creating opportunities. The other is resourcing to the partnership with Henry Ford. Part of the enthusiasm and support of that, I wanted to share with you. This is what's been happening with total NIH awards at Michigan State. What hopefully you'll see, and it's been all of your really hard work, is substantial growth in NIH funding. Now, many of the AAU universities have substantially more human health research, and it's seen as a priority for Michigan State, but we're moving it up quickly. And one of the goals of the partnership with Henry Ford is to bring together strengths in research, education, and clinical care. And I'll draw your attention back to the slide of the interplay of those three things. And I highlight here that Henry Ford is almost matched to MSU in terms of total NIH funding. And there's work by our research leaders that will be more tightly linking our research programs, and the NIH funding will come under a common entity. So it will ultimately result in doubling of the NIH funding for MSU. And also Henry Ford is committed to, for every dollar MSU puts in to support research, they'll put in $3 for human health research. And so it's a nice way to to leverage the work we're doing, and the commitment is up to $15 million a year. So part of our effort in health sciences is how can we bring resources back to support the mission? And a nice demonstration, again, of coming together is that there are opportunities for us to have cross appointments. We have a number of people, right, that are in a leadership role at Sparrow and at MSU, McLaren MSU, and we're now forming connections to Henry Ford. And when they were seeking a chair of their department for obstetrics, gynecology, women's health, they looked to Rick Leach, who was and is our chair, and his department is number 5 in the nation in NIH funding. And they saw a way to bring together the depth and breadth of their clinical practice, as well as a commitment to women's health, in forming a stronger department, in one, again, that I think helps connect the research, education, and clinical care. We are submitting nearly $1 billion in proposals for the American Rescue Plan Act sorry, that's not quite right. There is the American Rescue Plan Act, which is making substantial dollars available across the country. And MSU has submitted a large number of proposals. I think the number may be close to 100 million. And this was harvested from an outreach across the health colleges. And projects include increasing our capacity for testing, evaluation, vaccine development and supply chain, public health and health disparities, capital projects to build out a BSL-3 lab and existing spaces for wet labs, big data, mental health, behavioral health, and COVID-19 related studies. We've also submitted a joint proposal with Henry Ford for $76 million. And the next steps in that is you've submitted proposals, and now it's meeting with legislators and meeting with the Michigan Department of Health and Human Services director to say, this is the work that we want to do, and this is the work we're capable of. And then they'll come back and ask for more information if some of these projects resonate with them, and we're hopeful. And then the last that I'll touch on is historically, we haven't had health sciences representation on the university's capital projects team, annual decisions. And what's been great is to get connected to that. And I think it gives us a voice in helping to prioritize. Importantly, we certainly have not been left behind in the past. As you can just look at the IQ as an example, and the work that's happening in the ISTB. But one project that was identified is really an effort and a need to explore developing a new facility for the College of Osteopathic Medicine. And so having a seat at the table and a lot of work that, Andy and his college has led in doing this evaluation will help us take it forward. The last slide I have before I turn it to my colleagues is that ultimately our job in health sciences is to really support all of you. And key to that, right, is there's so much that is happening. How do we learn from each other? How do we share that with each other? How do we share that with the community? How do we generate enthusiasm? And feel really fortunate that we did a search, and Nicole Simchek joined us as our Senior Director of Communications and Marketing. And she was the Director of Communications in the College of Communication Arts, which is the #1 communications college in the country. If that gives you a sense for the excellence that Nicole brings. Just super glad to have her on the team. And then we've brought 2 project managers to the team as well. And again, their goal is that as we're looking at all that we're trying to do to improve the lives and the impact of faculty, students, and staff, we just need the expertise to do the work to create that environment. As we bring resources in, how do we deploy it and how do we make this possible? And so these will be team members that are here to help. So with that, what I will do next is we will turn it to leaders across health sciences to share, and I will be the slide advancer. And so we'll start first with Dean Rasch, and if you don't mind, Dean Rasch, please just say next slide, and I will do as guided, sir.
Thanks, Norm. Actually, this is going to be easy because we put it on 2 slides. So next slide. Oh, you can go to there we go. So these 2 slides really outline what the College of Nursing has been doing, what our faculty and staff do, that reflect the tripartite mission of the university, which is education, scholarship, research, and service. So some of our recent wins, and some of you will know what I mean when I talk about this, but we just completed our reaccreditation for 4 programs and heard from the College on Collegiate Nursing Education that we met all of our standards without any concerns. As a matter of fact, they included a category that's not an official, but they said that we had met them in an exemplary manner. And those standards, 3 of them are quality, and 1 of them is program effectiveness and assessment. So quality has to do with a mission and governance, institutional commitment to resources. So that's both the EVP's office and the university and the resources we have in the college. And then one of the key pieces is curriculum and instruction and learning techniques. And I will just say that the team that met with us, when she talked about the response of students, she became emotional to the point of teary, because of how the students responded about the education and their experience in the College of Nursing. So the challenge was it was a virtual site visit. So we had to do all of this on Zoom. Oh, yeah. Anyway, and then, you have to have a resource room, and the resource room was virtual, and we've kept it up to date because one of the things we're doing is doing something that I wanted to do when I arrived here, and is to create a data center for the College of Nursing. And this resource room is the foundation of that. But the data that we'll be collecting relates to all of those standards that we have to meet for accreditation. Some of those data will be inside the college, some will be at the university level, and some will be outside of the university. The next big win is that most of you know that the bot building for research and nursing education, which was my predecessor, Mary Munt, got the money for this, or I should say, leverage the funding, right? Isn't that the technical term? But anyway, because of half of those funds were through NIH because of the level of NIH funding we had. They have had virtual site visits over the year. And we just participated in our last site visit, and it was virtual. They were, the team from NIH was amazed at the building, but amazed at the work that nursing research that we were doing, and commented they had no idea that nursing research encompassed the kinds of things that we were doing. One of the pieces I would say about that, and that's the next piece with research and NIH rankings. When I arrived, before I arrived, we had fallen off the rankings. And the last time we checked, we, among schools of nursing around the country, were ranked at number 36. And Dr. Barb Given, who's our university distinguished professor, retired, she checked in it and she said, and she thinks it's even higher than that because of the way that they had counted the funding. They had left some of the funding out. So we're moving in the rankings among schools of nursing in terms of NIH funding. But we've had a lot of funding from other sources for our faculty. We have PhD students who are involved in funding. And one of the things I'm particularly proud of is we have energetically participated in undergraduate research, and we have a number of students who are baccalaureate students who are participating in research that's funded as well. The EVP mentioned the same project, and the only thing I would add to it, you covered that comprehensively, my man. The only thing I would add to it is one of the unique things about it here at MSU is that this project, to increase the number of sexual assault nurse examiners, has a component that's a little different. So it's in general that, but we're also doing something that particularly trains them for university campuses. And this comes out of the experience that we had here at MSU. So that's a small piece of that, is that not only are we doing those sayings, but we also have a focus in there for how to do that on university campuses. So that training encompasses that. And then the last thing, I think one of, our graduates, I think it's about 85 to 90% of graduates from the College of Nursing stay in Michigan, and they're all over Michigan. And so a project that we just did is a campaign highlighting our alumni who have gone home to practice. So it illustrates those stories. And we're calling them neighborhood nurses because some of them are in hospitals, but many of them are in communities. And so it illustrates what we're doing in the College of Nursing. And this anticipates the Institute of Medicine, actually has a different name now, National Academy of Medicine, there we go, did a study, and they recently updated that study on the future of nursing. And one of those futures is that while we prepare people to work acutely in hospitals, they have to be able to work acutely in the community and community health. And so one of the things this highlights is those nurses who graduated from MSU who are already doing that. And my next and last slide. So we're looking towards the future. One of the things that we need to do there, the pandemic, one of the effects of the pandemic is that it increased the acute shortage of nurses because so many have given on the front lines and they're worn out, they could retire, and they are. And so the need to really increase the number of students, the number of graduates has become a tremendous thing. One of the things it's doing is with our health partners, relooking, and this is true across the country, relooking at the role of the nurse and how they collaborate with non-nurses in providing nursing care. So those are nursing care technicians, orderlies, nursing assistants, those kind of folks. Henry Ford Health System is actually looking at leveraging licensed practical nurses to do that high touch thing that doesn't require the education of the BSN prepared nurse. And that's a long topic. But the other thing that we want to do is build a state-of-the-art simulation, because if we do that, one of the things that we can do is increase our capacity for admitting students. We have about 300 to 400 people every year that want to get into nursing, and we can only admit a third of them. And the reason is access to clinical experiences. But with well-designed simulation, we can do that education. So example, you can have a group of students in a hospital or another setting 1 week while a group is in simulation, and then switch. And the research on that shows that those students who participate in high quality simulation, the outcomes for them are as good or better than nursing students who experienced a traditional clinical piece. So the EVP mentioned the group practice. We're looking at establishing a group practice for nursing, and a lot of that will be through HCI, but other opportunities as well. We have been clear that the reason to do this is to develop new knowledge, not just through research, but how do you develop knowledge from practice? And it's something that all of our students need to know, because it's not an organizational thing only, it's individual clinician as well. Curriculum will be implementing a new curriculum, the standards from the American Association of Colleges of Nursing, those new essentials for competencies were just voted on. I'm on that board, so we really push that. And we're looking at what is the knowledge that faculty need to implement these new essentials. So it's not just clinical care. BSN graduates, advanced practice graduates, and PhD graduates need to know financial literacy of the organizations they work in, because they can begin demonstrating the kinds of outcomes that nurses contribute to in terms of patient outcomes and what that means for the bottom line. Leveraging development. We've been pretty successful. When I arrived, the capital campaign was in full swing. We beat our goal by $2 million. What I'm really proud of is that $2 million of that came from faculty and staff. And the number of alums, while they contribute $250 to $500 on average, but the number of alums that contribute has gone up tremendously. So it shows the faith of our alums in the work that the college is doing. We need more endowed faculty positions. We have a fully endowed McLaren chair for biobehavioral nursing, and it is to impact patients at McLaren, both in hospital and outside, for biobehavioral outcomes. And that's not just the psychiatric patients, that's across systems. And so we're looking to hire, recruit for that person. So if you know anybody who's a nurse that has competencies in psych mental health nursing, and I want to be clear, it's not psych mental health nurse practitioner, but psych mental health nursing and how to do those impacts, we're looking for that. And then last, our great opportunity for research, we're still leveraging that. So our focus is stealing or poaching, because we're in Vegas here. Outside of that, we won't call it that, but we're looking for those faculty who are mid to late career associate professors or full professors who have active research going that would not only be a great addition to the College of Nursing, but if you look at the research across the campus, there are great opportunities for team science with nursing. So there's a great opportunity to bring those in. And we need those because our folks are retiring. And what we've done is leverage their knowledge and experience with our faculty to be successful in getting NIH funding, but our students as well. So a lot going on in the College of Nursing, but like I said, it covers the tripartite mission of the university, and that's represented in the work that the faculty and students are saying. We have a great faculty. They've been very engaged and are a tremendous part of our success, but so are the students that we recruit as well. So thank you for the opportunity.
Yeah, thank you. And what a wonderful summary. All of that's really important work. Bravo, College of Nursing. You know, one of the things that we're going to start, and we just reference, is we're going to include some stories that we'll post on the website of important work that's being done. This is a video that we're going to make available that features Patrick Hawkins and some of his work with neighborhood nursing. Super inspiring work. So thank you.
And can I say something about Patrick? So he's nationally recognized for his work, and we're working on getting him in as a fellow in the American Association of Nurse Practitioners. But some of the work he's done in nephrology and all of that is nationally recognized, and he's headquartered in Flint.
It's wonderful. You know, the part of this is that if you know the why, there's no what you can't overcome. And as we look at so many challenges, seeing who you're walking with, right, and the mission that they're on. So appreciate hearing from the college. And I've listened to this video with Patrick, and it's really wonderful. So thank you, Randy, and thank you. Aron, please.
Great. Well, let's hope that I know what slides are coming. So so next, Norm. Oh, and one more after that. So people probably may have seen this map. The main thing that we are working on a campus at Henry Ford. So a little farther to the south and east, we've submitted the accreditation documents. We have a community assistant dean. We are formally slated to be ready to open in 2023. It, in fact, could be sooner, but until the ink dries, we're not quite ready to promise that to our students. Next one. We got a few things that I wanted to just talk a little bit about here in East Lansing, leading in part all the work on COVID. One of our faculty members is the university physician. Our team at out of translational neuroscience, but then also with micro and partnering with packaging and communications and our HR folks out of the college and logistics out of the college. The early detection program, Spartan Spit, was a huge amount of work and really successful. And then a lot of the university's modeling came out of epidemiology and biostatistics, folks working through the summer, even though they aren't necessarily paid for the summer. So a lot of people stepping up to make that work. We also have also in Epi, our folks in Epi are working on the COVID-19 death investigations model after maternal death investigations. So there's a lot of work on that, plus really trying to address the disparities and inequity that came to the fore, were made obvious, but then also persist in COVID-19. And there was, in fact, especially last spring, a fair amount of progress in the state. I think we're struggling a little bit again now, but we also had folks working on the convalescent plasma program, and some of our students returned to clinic early in the during the pandemic last spring, amongst the first in the country to get back, and we had people all over the state getting vaccines. So next. In terms of Flint, we had some particular successes in public health. Mona Hanna Atisha did a lot of great work with government relations, Jacob Covell and folks like that in Washington, getting the Flint-led registry into the CDC ongoing budget. And the Pediatric Public Health Initiative also got the Amy Sexton's work on fruit and vegetable prescriptions into the US Farm Bill, which last year actually went into practice. And then our MPH, through the great work of Wayne McCullough and his team, submitted their accreditation documents to CEF for 2022. We did some calculations. Overall, we've had $135 million worth of impact in the city of Flint. And we have awards now actually over $80 million in the 6 years that the division has been active. Next. In Grand Rapids, this is actually a lot of work following the really spectacular leadership of the previous dean. You'll see some buildings on there. This is the Grand Rapids Innovation Park, which is just at the bottom of the hill from the Sakia Center and next to the Grand Rapids Research Center. Right now, the Doug Meyer building is pretty much all the way up, and we're working on having people get in. The cyclotrons are in. This has actually been pretty well covered in the news, but it's really exciting. Some of the most advanced medical cyclotrons in the world that will, I think, really provide special opportunities for care and research for our faculty and for the communities. The Perrigo, which is they're the folks who make most of the Tylenol and ibuprofen that are purchased in this country as generics. Their headquarters, their North American headquarters, will be in that building, that tallish building there. It's a real opportunity for more collaboration and trying to bring care to people in their homes, which we all know from the pandemic has been such a big deal, and an opportunity for all of us in many ways, whether it's where we're working from or how we're getting care to the people we serve. Next one, Norm. This also continues on really almost 2 decades worth of work in Grand Rapids, more than 2,000 jobs as a result of the work of the college and Michigan State University, $339 million annual economic impact, more than $3.4 billion over the last 10 years. And the medical mile has had direct expenditures of about 200 million over that time period. Actually, can you go back one? I think what one of the things that our communities need in post-Rust Belt places is to diversify their economy. And that is one of the opportunities one of the reasons actually Michigan State exists. That's a part of why it was originally founded. That was for farming and agriculture and things like that. But I think the mission of the university has gone beyond that, but is still rooted in trying to make life better for people in our communities. Next. We are bringing our next class in 5 days. So there are 189 of them. They came out of a pool of a little over 11,000 folks who applied. 85% of them are from Michigan, 23% come from groups underrepresented in medicine. That's a wee bit below our running 4-year average, which was about 30%. 51% of them come from a disadvantaged background and 23% of them are rural. We feel really good about this group of people. It'll be exciting to have them in masks, but in person. So next. All right.
Thank you, Aron. Really appreciate that. And one of the work in Flint again is incredibly impactful in connecting to communities, and the discussion of social determinants and economic advancement. And importantly, one of the things that has been done with the 2 latest buildings in Grand Rapids is they've been built for using someone else's money and not the universities, and instead they've created a funds flow back. And I think that how you've leveraged the importance of the work that you're doing to get other folks to invest is a key strategy for the university. So thank you for that. Dean Amalfitano, please, sir. And I think you're on mute, Andy.
Thanks. Sorry about that. If you go ahead and advance the slide. Thanks, everybody. In this endeavor, this is so tough to come up with a couple slides and brag about all the things that are our colleges and not miss anybody. So I'm going to apologize right off the bat that if I don't happen to mention you. Well, I'm going to give a kind of a high altitude view of the college, and there will be places to go and hunt down more information. So first and foremost, our mission is providing world-class osteopathic, student-centered graduate medical education and research to foster greater access to patient-centered medical care. The reason I point this out is it's important. It guides everything we do, and we're undergoing an accreditation cycle. And so we'll be highlighting this emphasis in particular in the coming months. So thanks for acknowledging that. And next slide. A couple pride points that are listed here. And there's a lot of them. That's why the font's kind of low. But you know, it's difficult to measure outcomes of success when it comes to medical school students in particular. There's ways to do it. You can look at, you know, board scores, et cetera. But one of the things that we lean on as a college is the Residency Match, because this is an outside validation for us of program directors across the country looking at our students and having confidence that their training is adequate and actually exceeds expectations. We were actually part of a pilot program conducted by AAMC, and that was actually validated. But we've had a 99%, greater than 99%, 99.3, I believe, residency match rate since 2017. I think that's spectacular for 2 reasons. Not only that percentage, but you have to think with our college in absolute terms. We graduated approximately 290 DOs a year. And so to maintain that kind of a percentage with those type of numbers, I think is an important pride point. Coupled with that 70% of our graduates stay in Michigan to do their residency training and ultimately practice. Again, high numbers of graduates coupled with high percentages equals a lot of DOs in the state of Michigan, populating most of the major systems as well, our alumni, of which there's over 7,200 now. Another pride point is our statewide campus system for graduate medical education. We just hired Assistant Dean Obando Solano, who has been involved with MSU in the past and CHM and has joined us, and now at COM in this program. It's important for a number of reasons. This is a national program that I think stands out. I mean, all the programs, all the residency programs, of which there's approximately 30 now represented, are all ACGM, under the ACGME umbrella. No question about their capabilities to produce quality physicians. This involves a collaboration with 35 hospitals and 2 federally qualified health centers, and approximately now 2,000 residents and fellows across the state. I mean, to give you a perspective, University of Michigan has about 900. And these are affiliated, they're still, sponsored by their host institutions, of which many times they're competing institutions, yet they are all part of this system that Dr. John Rohr, who recently retired, sort of pulled together, and Dr. Obano is going to take to the next level. But I'm telling you, I've been at places where, the hospital across the street's been alienated from the academic medical center, and here we have 35 different centers working together. It truly speaks to the community-based sort of architecture we aspire to. Next thing is research as a priority for the college. I've been trying to emphasize what we do. We actually have posted a COM research strategic sort of current undertakings as well as plan. There's the web link. You can go and look at it yourself. Listed there on the massive Excel sheets for your viewing pleasure are the thousands of publications that our faculty have produced over these last few years, as well as the hundreds of extramural grants that have been awarded to the tune of tens of millions of dollars. And so if you want to take a look, and again, it's expansive, but still doesn't reach every point, but it certainly is a priority. And in there, you will read about some new centers. We have some existing ones, but global neuropsychiatry out of the psychiatry department is one in which we've invested heavily, and you can read about its successes to date as well as future plans. More recently, we have a cluster hire underway in regard to a new applied immunology center that we want to foster that type of research, not only in our college, but across the health colleges and beyond. Lots of faculty involved in that. And then more nascent is our neuromusculoskeletal research center, in which we're going to be looking at scientific backgrounds of many empiric therapies that osteopathic physicians employ, like osteopathic manipulative treatment, potentially in the future, functional medicine, other elements of medicine that are under researched, and we feel we have great expertise here to pursue. You all know about our DO PhD training program. It's the largest one in the country. We have about 45 students, I believe, in there right now, all funded by the college. We are in the process of applying for an MSTP designation. We have a student research accelerator. This is a program started in which any COM student who does research in a laboratory, the PI can receive up to $1,000 per student to support supplies, et cetera, to kind of prime those pumps of research to get more activity. And I'm really pleased that our faculties across the colleges have embraced this and offered more opportunities for our students, which is accelerating. And then finally, if you didn't know, we actually have a Spartan medical research journal. This was primarily coming out of our statewide campus system, the need for our graduate medical education partners to have venues to present their scholarly activities and research. And so this just received a PubMed recognition for all those publications, and something to think about if you're looking for a place to publish. Our future is bright. We've had, as noted, about 150% increase in applications to our college since 2016. I think it is a testament that those wannabe physicians are choosing to apply to us and then come to us in greater and greater numbers. Last year was the so-called Fauci effect of about 16% increase, and I'd like to report that we beat the Fauci effect by 8%. So there's just a momentum here that we're really proud of, and we've had with that 150% increase, even higher increases if you look over time in the number of female applicants and the number of applicants who self-identify as an underrepresented minority. And a point here that I think we should all kind of collectively look at, knowing we have work to do, but together with CHM, MSU, the two colleges graduated more minority physicians than all other Michigan medical schools combined since 2016, according to my numbers when I look at AAMC and ACOM public data. So I think it's something we can all share in and know we have work to do, but we're trying as best we can. Next slide there, Norm. Another point here, have a strategic plan in place. We've had it for a couple of years, but I really wanted to highlight elements of how we got there. We have something called the creating community process underway in the college. This, unfortunately, unfortunately, it stems from the fact that we had, and it's, you know, no secret, we had a dereliction of duty of our former dean and at MSU administrators in the past. It caused a massive climate problem, both working wise and educationally in our college, that we had to come to grips with rapidly and address. And I'm so proud that we faced it. We developed a number of external climate reviews to look at this, look in the mirror, look at who we are, try and understand what we've been through, and develop from that a plan to address it and go forward. And so we developed something called the Common Ground Framework, and that has energized our strategic plan. So if you go to the next slide, I'll end with this. The strategic plan has 5 key areas of focus that you can see there. We certainly focus on our osteopathic principles and practice as clinicians, culture, diversity and inclusion, recruitment and retention, curriculum, educators and scholarly activity, alumni and community impact. You can read our plan online. It actually parallels closely the MSU sort of developing strategic plan in many ways. So we don't anticipate any kind of change. It actually looks like they lifted elements of our plan, but you know, if you look at it, but it certainly aligns. And some initiatives that derive from that are, we certainly embrace, as I've mentioned before, our need to diversify the medical profession. We've emphasized that by creating an office for diversity and campus inclusion. And we recently have had join our Associate Dean for Diversity and Campus Inclusion, Dr. Marita Gilbert. She's fantastic, doing a great job, and we're already seeing such great benefit from her insight and her office's insight. This Common Ground Framework is the final point. This this derives from our look at our climate and looking at things. Certainly we have contributed in regard to what was mentioned earlier about the RVSM policies and how to address that, triage systems in health team. This is a framework to look at professionalism. So things that maybe don't rise to RVSM, but certainly are not to be overlooked or neglected. And this truly is, I think we are out in front on this in the university because we've had to face this for years. So you can go to that website and look at what we've rolled out, but this is an opportunity for our college to not only formalize the process of calling out unprofessional behavior, either with our faculty, staff, and students, of which all are under this, but more so it's an opportunity for us to highlight those great professional efforts that all of us are undertaking. So we formalized this into a framework. I don't have the time to list all the people involved, but they really are committed. Spent a lot of time to make this happen, and we've implemented this. And I think all this together is speaking to why our college is drawing such great numbers of future students, because I think they recognize what we're trying to do and put our best strategies forward. So I think that's it. I appreciate everyone's time.
Yeah, Andy, and I just want to reflect on this effort. And no one can speak to it better than you, and how in the midst of what was a horrible tragedy, the college came together in ways few colleges could to address this. And it should make us all proud to see the way that the college responded, and hopefully you feel our support as a university, because this is really something incredible. And then the other, so thank you. Thank you. And the other point is that one of the things we did in formulating the university strategic plan is to really learn from the colleges. And so you will see a lot of alignment as Andy called out. Lastly, but certainly not leastly, is Chris Allen, our MSU Healthcare Chief Nursing Officer. And I believe most of you know Chris, but she's been absolutely extraordinary. And we didn't used to have the position of Chief Nursing Officer, and it became clear when we looked at our efforts for quality, for safety, for access, that having that perspective was critical. And Kristine has been transformative and really helpful in our response to COVID as well. So look forward to your updates, Chris.
Thank you. Thank you very much. Can you hear me okay?
Yes.
Okay, great. Well, first and foremost, thank you for that introduction. I'm honored to be representing MSU Healthcare and the team that has done a lot of work just on MSU Healthcare as the transition from health team to healthcare, but definitely during the pandemic. So spotlighting that, and we can go to the next slide. The first thing I'm going to touch on is access. I could talk all day on access, internal and external, but there's a few spotlights that I think are really, really important for everybody to know what we're doing in regards to delivering access to our patients and internally and externally. And one of those I think is very exciting is a leading edge partnership with a company called Higi. And what that does is allow us, I'm sure you've read about remote patient monitoring and RPM contracts all across the state or across the nation, multi-million-dollar contracts with companies that allow us as providers to deliver care to our patients. If anything came positive out of the pandemic, we need to connect more in other avenues to our patients at home. The deans touched on this and some of the efforts that they're working on, but our partnership with Higi is one that is going to take us there. We had a kickoff meeting a couple of weeks ago with our primary care providers and our internal medicine providers in regards to this partnership. Our first phase of this is getting some basic equipment for mainly the 3 monitoring of blood pressure, blood glucose, and BMI or weight. And the first phase of that is getting the equipment deployed out to patients that we've recognized through the Medicare Part B program, get these tools out to them, and partnering with Higi allows us to have an extension of providers within the Higi Health framework that are an extension of our primary care providers. So it's really looking at extending our care across the continuum. What I like to say is about proactive care versus reactive care, and really doing some of those best practice multidisciplinary approaches to our care that allows us to do better with our management of our patients and get them more prepared for the most needed appointments in the practices. We know that we are leading the edge in regards to outpatient, right? Patients are going away, or care is going away from the hospital settings. So we're in the driver's seat of this. We've been able to leverage a lot of our conversations with these types of partnerships. So this Higi one is a big one for us. The next phase, back to that. So thank you. The second phase of the Higi agreement too will be we'll foster our providers to go in and be credentialed through Higi, to where then our information, as if, let's say I'm a heart failure patient at home and I need to do weights daily, those would simultaneously come into our EMR and would tag into our nurse triage teams within the clinics. So again, I really wanted to spotlight on that because that is leading edge. The other one is the Epion Health. This allows us, again, to do pre-visit check-in. So this takes us to the level of being able to complete our social determinants of health questions, our review of systems, our health history, all of that prior to our visit, collecting our insurance information, collecting co-pays, all of that work that currently is being heavily lifted by our staff, which takes into other challenges and creates frustrations and burnout, not only from providers, but also our staff. So we're looking at efficiencies and workflows. Referrals are another one that we're continuing to work on. We've partnered with Blue Prism, which used to be Thoughttonomy. Those are robotic bots that do work electronically. And the first thing that we're doing currently right now, we have staff that are printing off referral letters and sending them. For clinics that receive hundreds of referrals in a day, to print off letters and mail them is very cumbersome and time consuming. So as you can think about it, we can automate that process. So that's another partnership. The other thing I just want to touch on in internal is we strongly believe, right? Happy providers, happy staff make happy patients. We have to focus on wellness. We have to focus on taking care of our employees and our providers. And a lot of that comes from structure and workflows and things that we can do to improve decrease pajama time. I don't like that terminology, but it seems to be the one that everybody uses. But to decrease some of that and offload or right place some of the work where we have been not doing so well in regards to right placing some of that work. Phones, access, we've partnered with another large company called Sequence Health that is going to allow us to be better on managing our phones. The team has just done an outstanding job. We were greater than a 20% abandon rate on our calls to get into the clinics for patients. We have cut that in half just in the last 12 months. That's through a pandemic. We receive 2,000 calls a day. And you got to think about how many people we need. We have people answering calls plus checking patients in. So there's a lot of things that we're doing to right place that work. And then the other thing is that I'm going to touch on also is dashboards. We've done a lot in regards to just preparing and getting data that we can all trust and put our eyes on that data that allow us to put the focus and narrowed focus to the most important areas of opportunity. We haven't done that in the past. So it's really important for us to take this data and drive some best outcomes of patients, best workflow for employees and providers, and how can we get better on that? And the transparency creates trust. So we've really got a large framework I'll focus on in regards to communication as well, but those dashboards are a part of that. You can go to the next slide, please. Next slide. Oh, thank you.
Sorry.
Oh, skipped one. But there we go. I wanted to just share, thank you. I wanted to share our patient satisfaction. This is something, a lot of conversation, but if you didn't know, we started our patient satisfaction, our partnership with NRC Health back in February of 2020. We hesitated. That was, it was approximately about 4 weeks before the pandemic really went full bore. So, but we decided it was important. We need to hear our patient's voice, and it allows us again to narrow our focus and where we can meet the needs and demands of our patients. So we implemented this back in February. It's been a soft launch. It's been continuously going. 100% of our patients get surveys to be able to complete based on their information or based on their visit. This right here is what's called a Net Promoter Score. Remember the Net Promoter Score, if you've heard this through hospitals, HCAP scores, those types of things, it's those who rate us a 9 or a 10. Those are the individuals are most influential to by word of mouth in regards to our quality of service. And we are just doing an outstanding job. As you can see, we're trending well into the 80%. That is the best, well above 80, 85%. And that is some of the best clinic Net Promoter Scores we can see across the continuum of NRC Health. And across the nation. So you can see that N equals 39,195. That's how many people have completed our surveys in the last 12 months. So a large spectrum in regards to the voice of our patients. We can dive into this by provider. We can dive into it by question. So this is really creating some momentum for us to be able to listen to our patients. The next slide, please. Thank you. I want to spotlight communication. I think communication is very near and dear to my heart because I strongly believe that the more that we are transparent and communicate at all levels, we can never communicate enough. But to communicate at all levels create transparency, and transparency creates trust. And we need to build those relationships. We have built a multitude of aspects here. These are just entry-level aspects of our communication levels that we're building. One has been leadership rounding, just getting leaders out and rounding in the clinics and asking some 4 basic questions of how things are going. Do you have the tools and equipment to do your job? Is there anyone we can thank? We don't do enough praise. You know, it's definitely known that it's a 3-to-1 ratio. For every 3 negative, you need 1 positive. And we need to make sure that we are really impacting and putting positive influence into banks, what I call them, right? The positivity bank. But we want to reward behaviors and accolades that we want to get repeated. So that's where this communication aspect comes into this. We're working on a monthly newsletter that will come out in August, will be the first one. Communication boards, the strip here you'll see where it says people, service, quality, growth, and finance. Again, it's structured around service excellence, focusing on these 5 areas of excellence and making sure that we're really diving into this and have a cadence of consistency across our communications. We've installed communication boards in all the clinics, allows us to be able to be transparent with data. That includes patients being able to see the data as well as everybody else. And then the intranet distribution list, monthly collaboration meetings and dashboards. Again, these are all metrics in regards to communication that we're focusing on. And the next slide. I think this is mostly on the service excellence focus. Again, creating a structure. We've had some change. We know we've got to focus on quality. Our structure, a longtime leader has retired from MSU Healthcare, and it has allowed us to really dive in and say, okay, what could we do differently and stronger to focus on some best outcomes and some quality measures. I touched on this proactive versus reactive approach. We really want to go to wellness, multidisciplinary team structures where we have nurse practitioners, nurses, PAs, providers, medical assistants, clinic coordinators, everybody that's really working in a multidisciplinary approach. And then creating a governance, such as the clinical governance, clinical informatics, a clinic liaison is a new one that's we've hired that starts next week. And that is to bridge the gap between academics and the clinical practice that allows for improvement of onboarding our providers into the clinic realm. So that's a huge kudos. And then the clinical informatics is a team where we've hired in a partnership with the College of Nursing with Camille Jensen, and that is leading our clinical informatics that also bridges our gap and allows us to work elbow to elbow with you as providers to increase efficiency within our EMR and our optimization of our IT world and improve your efficiencies. And then Dr. Avellino doing a lot of work in regards to provider and staff wellness with Dr. Finkelstein and the surveys, really focusing on those efforts as well. And then the last thing is I just wanted to touch on a few growth opportunities, and these are just a tip of the iceberg, is a GI clinic. We have hired a couple of GI providers, and we are opening a GI clinic within MSU Healthcare, and we're very excited about that opportunity. I don't have a date of that starting yet, but that is one new area. And then a vascular lab, Dr. Lynn has joined us and is working with us to create a large vascular lab that will be simultaneously located within the surgery suite as well. And I already touched on Higgy joint ventures. We've got Spartan Radiology and other joint ventures that we continue to be in discussions with, and before those things are finalized, you'll hear more about those joint ventures. Again, that allows the health team, the healthcare to become independent and as we move forward. And then some opportunities, as always, we've got some expense management opportunities, staffing alignment, and quality initiatives that I already touched on. And I think that's it.
Yeah, thank you, Chris. Really terrific, clear validation of the importance of the chief nursing officer and transformational. And I really like how you shout out your team because they have come together in remarkable ways. Really pleased. And one of the things I would note is if you look across healthcare in the US, virtually every health system actually went deep into the red. But MSU Healthcare rallied in a way to be able to continue to support faculty, staff, and students and stay in the black, which is nearly impossible. So well done.
Thank you.
Yeah.
So Norm, we
Yeah.
are at time, but I wanted to recognize that we did receive quite a few questions on the vaccine mandate. So I will ensure that those questions are answered in the FAQ that's coming out. And then there were also concerns about how you volunteer for vaccine events or wanting more medical expertise on how and why the vaccine is effective. So we'll be sure to include all that when we send out the link from this town hall and address any other questions that we weren't able to get to today. So thank you, everybody. Norm, any final words?
Yeah, just a few. As it relates to the vaccine mandate, there'll be so much more information coming out about that over the next couple of days. I know there are a lot of questions, and normally you would sequence things where you would have all of you'd have the FAQs come out at the same time that you announced the vaccines and the max mandate. But it was just felt really important to give time to respond, to identify the vaccines requirement immediately. And then it was on Friday, actually, that Ingham County moved into really the zone dictated by the CDC to when masks are required indoors. So again, bringing that forward. It's important to shout out Dave Wisemantle, who has done a great job of stewarding this. And so there'll be answers to the questions. And then perhaps most importantly, just to recognize the colleges and the practice, all the great work you heard about, best shared by the individual organizational leaders. And as we navigate such difficult times, I'm hopeful it gives everybody comfort to see how much work is being done in each of the colleges, in the practice and together. And again, with a focus on faculty, staff, students, and impact. So appreciate it. And then the final thing that we didn't mention is, and I stopped sharing screens, but it's going to be continuing conversations. What I will do with a few other members in health sciences is to visit the colleges individually and the practice so that we can answer some of the specific questions that I think may be more college specific, and also get input into how to do things better. So thanks so much.
Thank you. Thank you, everyone. Have a great afternoon.